This is Emily Walker, MedPage Today, reporting from Washington. The ACP this week released a report that found that healthcare is in a state of decline. I spoke with Dr. Joseph Stubbs, who's the president of the ACP and an internist in Albany, Georgia, about some ways that decline can be reversed and his thoughts on the likelihood of Congress passing healthcare reform this year.
The healthcare reform, which was moving quite rapidly, has had the wind taken out of it with the election in Massachusetts of the Republican to replace Ted Kennedy's seat, causing the Senate to lose this supermajority Democratic-controlled Congress, Democratic position. But I think the purpose of this report is to say that the healthcare, the state of healthcare is, as it's going right now, is completely untenable. So what we're hoping for with health care reform is to get the House and Senate back together to look at what was good from each bill and really try to come together to come to some agreement to move forward with this thing. From a standpoint of my patients, though, my patients, I think a lot of patients in Georgia where I practice, are very concerned about the role of government. And they haven't been, they're concerned because they're afraid of losing something that's very valuable to them, which is their health care and access to health care delivery system. I think what we're trying to do as an organization is to try to let them know that I think that what the government's doing is to try to expand their options and make their health care, make them feel more secure with their health care by controlling the cost, bending the curve so that we can continue to afford the quality health care that they've been having.
President Obama is hosting a bipartisan summit of lawmakers next week to try and reach a consensus on moving forward with health care reform. Dr. Stubbs shares what he hopes will be accomplished at the meeting. What
I hope to be accomplished is for them to understand and come to a better realization of the common ground that are in both bills. There's issues with regard to primary care reimbursement, fixing the SGR formula, that have broad bipartisan support, and providing insurance market reforms and providing coverage for all Americans. These are issues that both Republicans and Democrats can come around to. And then once they see that 80 to 90% of what's in these bills is something that they can all support, that they can come up with some kind of legislation to push over the line the dealing with the other 10%.
In the next few days, President Obama is expected to hand down parameters of what he'd like to see in a health care bill, which will likely be some combination of the legislation passed by the House and the Senate. From Washington, I'm Emily Walker, MedPage Today.